Here is the question. Right, so if you have read and understood, let's begin our session. What do you see? What are these arrows pointing at?
Diploid veins.
Okay, what are diploid veins?
They are the veins that connect with the extracranial veins with intracranial veins.
Okay, this diploid space to the dural venous sinus. Okay, can you tell me at what age cranial sutures ossify?
The cranial suture ossifies from 18 to 24 months.
Very good. Okay, and if they are fused at birth, what does it call?
It's called craniosynostosis.
Okay, mastoid bone develops at what age?
At 2 years.
Okay, can you tell me what are the lateral sinuses of skull?
Lateral sinuses is sphenoid sinus
And
the maxillary sinus.
Okay. All right, can you tell me what is pterion?
Pterion is the H-shaped suture that formed by the frontal bone, parietal bone, temporal, and the sphenoid bone.
Okay, can you please tell me how many dural venous sinuses you know?
I have to count it or name them?
Yes, yes, you have to label, identify them from 1 to 8, please.
Okay, ma'am. 8 is sphenoparietal sinus.
Okay.
6 is superior petrosal sinus. 5 is inferior petrosal sinus. 4 is sigmoid sinus. 1 is superior sagittal sinus. 2 is the straight sinus, and 3 is the junction of straight sinus. Sorry, yeah, straight sinus.
Just tell me all quickly, please.
Okay. Suprasagittal sinus, infrasagittal sinus, straight sinus, transverse sinus, conference of the sinus, sphenoparietal sinus,
They are also mentioned paired and unpaired. Can you name the ones which are unpaired?
Yes, ma'am. The unpaired is suprasagittal sinus, infrasagittal sinus, straight sinus, conference sinus, and the occipital sinus. These are unpaired.
Can you tell me what is the importance of cavernous sinus?
Sorry?
Importance of cavernous sinus?
Yes. Cavernous sinus drains blood.
Tell me first, where is it located, please?
Okay, it is located on the lateral side of the pituitary fossa.
Okay.
I mean, sella turcica.
Okay. And it drains blood from where to where?
Okay. It drains blood from the supracerebral vein to the sphenoparietal sinus, emissary vein, and it drains to the superior inferior petrosal sinus and intercavernous sinus.
Okay. What does it contain?
Okay. It contains medially internal carotid artery and the abducens nerve, and laterally oculomotor, trochlear, and the first and second division of the trigeminal nerve.
Okay. Can you tell me what do you understand by the term cavernous sinus thrombosis?
Okay. The cavernous sinus is connected with the physeal vein through the supraophthalmic vein. And the physeal vein drains the danger area of the face. That means the medial angle of the eye, nose, and the lips. So when there is thrombophlebitis of the facial vein, their thrombus may go to the cavernous sinus through the supraophthalmic vein and leading to painful swelling of the eye and diplopia and the loss of vision, gradual loss of vision, and also nerve damage of
yes.
producing paralysis of the third, fourth, fifth,
Yeah.
sixth cranial nerves.
Okay, what are the signs of thrombosis? How would you come to know patient is undergoing thrombosis or thrombosis?
There will be painful swelling of the
Yes,
eye,
yes.
gradual loss of vision.
Very good. And the involvement of which cranial nerves?
Third, fourth, fifth, sixth cranial nerves.
Very good. Okay, very good. All right. Can you tell me what you understand by the term falx cerebri?
Sorry, ma'am?
Falx cerebri.
Okay, falx cerebri is a dural fold, the
Yes.
meningeal layer that runs in between the cerebral hemisphere and through the upper border, suprasagittal sinus runs, and the lower border, infrasagittal sinus runs.
Okay, good. Can you tell me what is the nerve supply of the tongue?
Okay, the tongue is motor supply is hypoglossal nerve,
Yes.
except the palatoglossus, which is supplied by the vagus nerve, and the sensory supply anterior to third. General sensation is lingual nerve, and for the taste sensation is chorda tympani, and for the both general and the taste sensation in the posterior 1/3 is glossopharyngeal nerve.
All right, good. Can you please tell me what is the course of facial nerve in the cranium? Intracranial course of facial nerve, please.
Okay, facial nerve exits pontomedullary junction.
Yes.
Medulla and pontomedullary junction. Then it runs through the internal acoustic meatus.
Very good.
Then to the vestibular canal.
Okay.
It exits through the stylomastoid foramen.
Yes. What are the branches in the face?
Face's branches are the temporal,
Yes,
zygomatic,
those are 5. Yes.
buccal, upper and lower division, marginal mandibular, and cervical.
Can you please tell me how would you differentiate between upper motor neuron lesion and lower motor neuron lesion of facial?
Yes, upper motor neuron lesion face in case of upper motor neuron lesion, there will be upper half of the face will be spared.
Yes.
On the ipsilateral. No, sorry, I mean opposite side, contralateral side. But in case of lower motor neuron lesion, there will be ipsilateral paralysis of the both upper and the lower face.
All right, good. Thank you. Can you tell me what you understand by the term acoustic neuroma?
Pass.
Okay, can you please tell me why the patient with acoustic neuroma hears voices louder on the affected ear, affected side?
Okay, in acoustic neuroma, it may involve the facial nerve, as
Yes.
the facial nerve passes along with the vestibulocochlear nerve through
Yes.
the vestibular canal. So usually the facial nerve causes, due to the paralysis, there will be paralysis of the stapedius muscle.
Yes.
That is applied by the facial nerve.
Yes.
And usually stapedius muscle limits the oscillation of the stapes.
Very
so
good. This results
paralyzed.
in,
yes. This results in hyperacusis, as it cannot control the ossical movement. So there will be hyperacusis.
Very
Heightened reaction of the sound.
Very good. Good. Excellent. Now we will look at, yes, they are telling you. Right, now we will look at what you were telling me about the, what happened. Okay, yes. Right, now we will discuss. So one, what did you say one was?
I say
Superior sagittal sinus.
Oh yeah, yes it is.
Okay, and two?
Two I said straight sinus.
Yes, 2 is straight sinus. And then 3?
3 I say probably infrasagittal sinus. I think it will be great cerebral vein.
But it is great cerebral vein.
Yes.
Yes, and then 4?
4, I said sigmoid sinus.
Yes, it's correct. And then 5.
5, I said inferior petrosal sinus.
Yes, that is correct. 6, please.
Which one is 6? No?
Yes, here.
Oh, superior petrosal sinus, yes.
Yes, superior petrosal sinus. Yes. 7, please.
7 is intercavernous sinus.
The cavernous sinus.
It's cavernous sinus, yes.
Yes, 8, please.
It is sphenoparietal sinus.
Yeah, good. So 1 or 2 you had wrong.
Yes,
Otherwise,
yes, I did.
it was correct. Good. Yes. Nice. I'm happy. I think you should be happy as well because 1, it was random. Secondly, you didn't know which station I'll bring. And it was totally random. And I asked you from cavernous sinus to tongue and facial nerve and anything, you know, even ear acoustic neuroma. So I
But
think
I didn't get to the acoustic neuroma. What is
that you
acoustic?
can
This is
revise. Yeah.
benign
They told
tumor
you.
probably. Yeah, okay.
They told you here.
Okay, I'll check.
Tumor of.
Yes. Yes.
Yes.
Thank you.
So good. Excellent. Right.
Thank you, ma'am.